Welcome to your prenatal stretch. Today we're going to be opening the entire body. Remember to stretch gently and slowly as your muscles will be more open during pregnancy. Let's begin in a seated cross-legged position. You can find your style either in Burmese, simple cross-legged, or if you need, you can bring the soles of the feet together. If you have tighter hips, you can take your blocks, place them underneath your knees. Go ahead and close down the eyes, taking one hand to your belly, one hand to your heart, and setting the tone for our stretch practice today. As you inhale, notice if there are any parts of your body that are particularly tight or maybe storing tension. See if as you inhale and exhale, you can begin to consciously relax these muscles. Feeling any tension or stress begin to slide away. Take 2 more rounds of breath, feeling your belly and your chest rise into your hands, and feeling everything soften and settle as you exhale. Go ahead and release the hands, bringing them to heart center. And as you inhale, sweep both hands up. Exhale, lower just your right hand down onto the floor. And let's take a side body stretch. Press down into the left sit bone, feeling that anchoring sensation. And as you inhale, reach and lengthen through the fingertips. Deep breath into the side body, filling up the rib cage. Exhale, soften the bottom shoulder. Take one more big breath in. And as you exhale, begin to round your body down towards the floor. Inhale, open the chest back up towards the ceiling. Exhale, rounding down towards the floor. One more time, inhale, open. Exhale and round. Inhale, windmill the arm all the way up. And as you exhale, switch sides. If you need to bring the floor up a little bit higher, you can always use a block underneath your hand. Wherever you are, begin to root down into the right sit bone. Take a full inhale through the nose. And as you exhale, reach through the fingertips, creating as much space between your hip crease and armpit crease. Big inhale through the nose. Exhale, rotate your chest down towards the mat. Inhale, open back up. Exhale and rotate. One more time. Inhale, open. Exhale and rotate down. Inhale, rise all the way back up. Shrug the shoulders up to the ears and down the back. And one more time, bring the shoulders up and down. Let's open out, right leg out to the side. Bring your left heel about 12 to 18 inches in front of your pelvis. Make sure you have a solid foundation in the hips. And we're going to begin to pivot the torso in between the leg and the foot, coming into a modified stretch. This will be kind of your first hip opener, so take your time. Begin to breathe into your low back, into the outer hip. And as you exhale, walking the fingertips forward. When you feel ready to lower the chin down towards the chest and round the back, you can. This little space in between your leg and foot is perfect for baby to rest in. We'll go ahead and take about 5 more rounds of breath here. Just noticing any areas that may be a little tighter. Some of you may feel this more in the back of the hamstring or the calf. Continue to keep the toes drawing towards your face, extending out through the heel. And then one more big breath in. As you inhale, rise back up. Grab a hold of your ankle or your toes and inhale, sweep that left arm up and over, side stretch. So this is where you can use a block. You can place a block on the inside of your leg and use this for support. And then begin to bend the elbow, pressing the head into the hand. We'll stay here for 3 breaths. Inhale, begin to arch your back like you would in cat-cow. Exhale, guide the elbow towards the back side of the body. 2 more breaths just like that. Inhale, lengthen through the crown of the head. Chest expanding. Exhale, elbow towards the back body. 1 more time. Stay for the exhalation. And as you're ready, inhale, reach for the ceiling and come all the way up. We're going to go ahead and place the left foot flat onto the ground, drawing the knee in towards the chest and sitting nice and tall. Stay here with a neutral spine, taking a few recovery breaths. And then when you're ready, let's go ahead and stretch both legs open wide into a V. So for many of us, this will already feel like a stretch. If you need extra support, you can use your blocks and place them underneath the thighs, toes still looking up at the ceiling. If you also have a tendency to hyperextend behind the knees, this is a great option for you. From here, toes pull back. Exhale, walk the fingertips forward. Keep the spine nice and long, pressing down into the sit bones, lengthening through the crown of the head. And remember, any of these stretches, it is best to move in a slow and gentle manner. So begin to breathe into the inner thighs. You may find a little rocking movement feels good in the body. And when you're ready, begin to walk the fingertips forward, maintaining that length from tailbone to crown of head. Breathing into the back side of the body. Exhale, maybe start to bend the elbows. And we'll stay here for about 5 to 7 more rounds of breath. Whatever part of your body where you feel the tension or feel the stretch, send your breath there, trying to expand and stretch the surrounding muscles. We'll be here for 3 more breaths, inhaling through the nose and exhaling out. Inhaling for 2. Exhale and release. Last one, deep breath in. Exhale all the breath out. Inhale, rise back up. Use the fingertips to walk yourself back to an upright position. And we'll go ahead and remove the props if you have them. Keep the left leg extended and we'll bend the right knee, placing the heel directly in front of the pelvis, about 12 to 18 inches. From here, pivot the torso in between the legs. And let's take our forward fold here. Deep breath in through the nose. Exhale, walk it out for your deepest expression of this stretch. And we'll stay here for 3 more rounds of breath. Feeling everything from the low back to outer hip stretch. Inner thigh and groin. This is also a wonderful stretch to prep for labor and delivery as it continues to keep the pelvic floor and low back open. Take 1 more round of breath in, and we'll slowly press the palms down, coming all the way back. If you used a prop on the first side, please use one on this side. Go ahead and rest the forearm down. Inhale, reach the right arm all the way up. Bend the elbow and start to press the head into the hand. Take a full breath into the chest, arching through the back. As you exhale, guide the elbow towards the back side of the body. 2 more breaths just like that. Should feel really nice to create the space around baby. Have more breathing room for the lungs. 1 more big breath in. Exhale, release. And inhale, come all the way up. Go ahead and bend the knee. And this time, we'll just go ahead and bring the soles of the feet together. And we'll come into our hip circles here, just taking a few in one direction, getting a little movement back in the body. And then go ahead and reverse the direction, rocking just from sit bone to sit bone. And then we'll go ahead and take the undersides of the knees, bring them up towards the ceiling, feet a little bit wider than hip distance apart. And as you inhale, arch the back for seated cat-cow. As you exhale, round the spine, chin to chest. And again, tipping the pubic bone forward, heart opening. Exhale and round. 1 more time. Inhale, lift. Exhale and round. We'll go ahead and just slide the feet straight, making a little bit more of a narrow forward fold. Inhale, arms reach up. As you exhale, take the hands all the way down the midline until the fingertips find the floor. Hinging from the hips, keeping the spine straight. Begin to walk the fingertips forward, coming into a forward fold. Make sure there's enough space for baby and that there is no compression on the belly. Draw the toes back towards your face, extending the heels away, and take 2 more rounds of breath. Inhale, press down into the sit bones, lengthen through the back body. Exhale, maybe walk the fingertips forward a bit more. 1 more breath in through the nose. Exhale, slowly bring the body all the way back up. Bend the knees. Let's go ahead and make our way onto all fours, hands and knees. You can go ahead and place your blocks at the front of the mat. And if you have any other props, go ahead and slide those off to the side. So knees as wide as the mat here. We'll bring the big toes to touch. Take the hands and forearms onto our blocks and come into a supported child's pose here. So we're going for now an upper body stretch, mid to thoracic spine. Forehead may begin to lower and find the floor. Taking 3 rounds of breath, you can rotate the palms to face one another. Allow the low back and hips to open. One more big breath in. Exhale, slowly release. Go ahead and come all the way up. We're going to go ahead and just move the blocks off to the side, and we'll do one final stretch, a supported pigeon pose. This will be our last hip opener. Go ahead and bring your bolster into the middle of your mat, and we're going to go ahead and walk the right foot forward. So left knee will find the mat. Right knee will open out to the side, and we'll just keep snuggling that back knee back as far as possible. So you have a couple options here. One, to stay in an upright position. Feel the stretch across the belly. Feel the stretch in the front of your thigh. Or use your blocks for support here and come down more into a forward fold where baby will rest in between the bolster and your leg, and forearms can come onto the block. So whichever one feels good to you, there are 2 variations for you to choose from. We'll be here about 30 seconds. It's important to remember if at any point something doesn't feel good or feels uncomfortable, to just move yourself out of the posture, take a recovery breath or 2, and then find a variation that works for you. Go ahead and take your last 3 to 4 breaths, feeling the outer right hip open, continuing to flex the right toes in order to protect the knee. Take one more breath in. And as you exhale, press the palms down, bring your body up. You're going to shift the weight over onto the right sit bone and just swing your left leg up. Easy transition from right to left side. You're going to go ahead and place left foot up, slide right leg back. Once again, you can stay in this kind of supported pigeon upright, or if it feels good and you have space between baby and the floor, begin to find yourself in your modified pigeon pose. And once again, staying here for about 30 seconds. See if you can allow the outer right hip to shift forward as the left knee falls down towards the mat. This is also a really good posture if you have low back pain or sciatica. This is a great posture to get more circulation into the lower body. Take one more breath in. Stay for the exhale. Inhale, rise back up. Go ahead and shift your weight onto the left sit bone. Swing your right knee all the way up. And come back to the starting cross-legged pose you chose. Place one hand on the belly, one hand on the heart. Slow everything down, and you just may notice a little buzzing sensation in the muscles. Allow yourself to reconnect back to baby, back to your breath. And that concludes our practice for today. See you next time.